call kickstand. And I will sit on the foot just to give them something stable so their foot's not slipping and sliding, especially if I'm on the mats. It's a bigger deal than on the table. And I will grab right above the knee and I will do that single hip traction.
This is the one you've taken out of it, because I know you used to do this one too. And that matters. I always forget about this one. Of course, my table's up so high, I probably can't get on it.
I had an electric table. My gosh, I would never massage without one now. I actually sold my other one. I was like, nope, not using this one ever again.
We have talked about having an electric table, but we're trying to move people off the table.
Yeah.
Exactly.
We're not going to invest that
Right,
much money into
yeah, exactly.
an electric table when we're trying to get away from it.
Exactly.
What do you do for your older clients, or do you not get many older
We
clients?
have a few, and most of them are pretty good on the mat,
Okay.
especially after the session,
Oh,
because everything's just more
probably
mobile.
spring up like a 20-year-old.
But I have other ones, especially if they have intense vertigo, that they can't
Oh.
get down on the floor,
Okay.
then I will still do the table with them. There's advantages and disadvantages to both.
Yeah, you almost need both, though.
There's a couple of stretches I prefer with the table, but overall I prefer the mat because I can use my feet and my knees.
Have you ever used one of those, I don't know if you've ever noticed in a physical therapy where they got the tables that are really wide and they can get on it with you. And I often wonder, as far as working on somebody on one of those, what that would be like.
I can get on a little bit with this one because it is one of the slightly wider tables. Robert teaches how to do some of the sitting, almost mat-based work on a table.
Yes.
For me, I'm scared of heights.
Oh, so you'd be up on that
So
table.
even
Yeah.
sitting on the table feels like it's almost too much for me.
Okay.
So I feel unsteady, and I know that.
Yeah, you would
comes
have to
through.
stand on that table, wouldn't you?
Yeah.
That
Well, I
would be
didn't
kind of
stand
crazy.
on it, but even just getting up and using my knees on somebody. So after doing that, I'm gonna come in. I'm gonna bring them right into, so it's what we call our hip holster. And if they're tight in here, this might not be possible at first. If that's the case, I use my hand under their knee and I support their leg here, and I do the stretch this way, and I feel a lot of restriction in her hamstring. Which, if we were on a mat, I would just automatically have said, okay, roll over, we're gonna do some hamstring work.
Exactly.
Yeah.
For today's purposes.
I'm just happy it's doing that.
The intention for this is getting this knee to that shoulder. Obviously, not everybody is that flexible. You just want to follow their body's cues to where it can go.
And sometimes I'm like, I don't know if the person too in their mind, because I have some clients, I'm like, I'm not even sure it moves at all. I'm like, are they holding it or does it not move?
I bet that feels like a break to you.
Yeah.
It's a good stretch. I can do that.
I will sometimes bring my arm in, and then I can get a little pressure in that hamstring with my forearm.
Oh yeah.